So the 13th question is, which of the following are the local complications of acute pancreatitis? The one is pseudocyst, then we have the pleural effusion, then we have the ileus, and then we have the acute fluid collection. So as to do this question, we must understand that what is the meaning of local complications and systemic complications when the acute pancreatitis is concerned. So when we manage the acute pancreatitis, we have two types of complications. One is systemic complication that are more important for morbidity and mortality in the first week of life. So systemic complications are to be managed within 1 week of acute pancreatitis, while the local complications become more important after the 1 week of acute pancreatitis because they develop after first week of acute pancreatitis and they become more important for mortality and morbidity after the first week. So local are the ones which are more important after 1 week, and systemic are the one which develop within 1 week and are more important within 1 week. So in the systemic complications, we have the cardiovascular complications like shock and arrhythmia. We have pulmonary complications like acute respiratory distress syndrome. We have renal complications like renal failure. We have hematological complications like DIC, disseminated intravascular coagulation. We have metabolic complications like hypocalcemia, in which calcium can go down, hyperglycemia, in which glucose can go up, hyperlipidemia, in which lipid can go up. Then we have the gastrointestinal complications like ileus. Then we have the neurological complications like the patient may present with the visual disturbances, confusions, irritability, and encephalopathy. Then we have miscellaneous complications like subcutaneous fat necrosis or arthralgia. So once we have managed these complications in the first week, now the local complications become more important after the 1 week. And these are acute fluid collection, sterile pancreatic necrosis, infected pancreatic necrosis, pancreatic abscess, pseudocyst, pancreatic ascites, pleural effusion, portal or splenic vein thrombosis, then pseudoaneurysm. So coming to our options, so we have option of the acute fluid collection, which is a local complications. We have the pseudocyst, which is a local complication. We have the pleural effusion, which is a local complication. The ileus is a systemic complication. So coming to our question. So pseudocysts develop after 1 week, more important after 1 week. So it's a local complication, that is after 1 week. Pleural effusion, again a local complication. After 1 week it is more important. Ileus is a systemic complication. This occur within first week and we have to manage it within first week. Acute fluid collection, again a local complication which develop after 1 week. So the option will be, the first will be correct, second will be correct, and the fourth will be correct. So option will be C, 1, 2 and 4 are correct. So this will be the correct option.